Knock, knock. Hello there, Miss Patel. Is it okay if I call you that? Jane? Hi, Jane. My name's Kaylee. I'm the doctor that's going to be interviewing you today. What brings you in today? Okay, I'm sorry to hear that. Can you tell me more about that? Oh, that's totally okay. How long has lately been? 3 months? You've been feeling down and tired? Okay, I'm sorry to hear that. Anything else you can tell me? Is it more than just feeling, down, tired? Do you feel like you can find happiness in anything or? That's good. Um, can you think back to 3 months ago, like what you think might have started this? Okay, if you're comfortable with sharing, I'd love to know. Uh-huh. Mm-hmm. Mm-hmm. Does that make you anxious? Something like that? Yeah. Hmm. I'm sorry to hear that. Have you felt like that before? Yeah. Mhm. Okay. Okay. So it's been kind of like a couple times now that you have felt like your heart's racing and you just feel anxious and overwhelmed whenever you have like a high stress, something going on that happens with you. Yeah. Yeah. Okay. Okay. I'm sorry to hear about that. So you've been feeling tired as well. I'm sorry if I look down. I'm actually making sure to write things down just to make sure I have a clear history, making sure I'm doing everything properly. So I hear that you've been tired as well. Are you sleeping okay? Mm-hmm. Mm-hmm. Why do you think that is? Yeah. Yeah. Is it hard for you to pay attention during the day? Do you feel, yeah? Mm-hmm. Yeah. And do you have any friends that you are ever with or family? Are you around family members or people that you enjoy? Do you have activities? Mm, yeah, yeah. Have you kind of always been like that, where you don't really socialize with people? Okay. When you're in a crowd, what happens? Mhm. Mhm. Has that only been for 3 months, or that's been for your whole life? Junior high? Mhm. Okay. Okay, understood. Alrighty. Well, I'm sorry to hear all that. I feel like I have a good understanding of the main reason that you're here. You're feeling very tired and down, and you have been feeling anxious, especially in crowds, and with your boss, that was overwhelming, and you haven't been sleeping and all of that. Is it okay if I start asking you about your past medical history? Okay. Do you have any other diseases like diabetes, hypertension? Okay. Do you have any medical history? Any diagnoses? No? Okay. Okay. Do you take any medication? No? Have you tried anything in the past that might have helped with these feelings? Yeah? What would that be? Uh-huh. Okay. Do you feel like that helped? Okay. Okay. Do you think you have a lot? Do you think, like, how much do you usually have? Okay. Okay. Yeah, that is a lot for, your size and just about anyone. So I'm sorry to hear that you feel like you need that to, feel comfortable. Hopefully today we'll be able to really get down to what makes you feel like that and help you in the future. Have you tried anything like therapy or anything? No? Okay. But it's been since junior high that you've been feeling these emotions. It's just been really bad over the last 3 months. Okay. And do you have anyone in your family that has ever felt anything like this too? Maybe they're anxious. Mm-hmm. Okay. Do you remember what pill that might have been? No. Are your parents alive? Mm-hmm. Or do they have anything else besides your mother with a depression at 38? Okay. Mm-hmm. Mm-hmm. Alrighty. Okay. And um, do you know when your last period was? 2 weeks ago. Do you notice any changes whenever you have your period in your mood or anything? No? Okay. Yeah. Do you have any children? No. Do you have anyone that you live with at home? Your own apartment? Okay. Do you have any friends, family that come visit you? Well, that's good. That's good to have family close by. Do you have any like pets or anything, keeping you happy? No? Okay. Yeah, I'm sorry to hear that. Are you part of any like churches or any groups? No. Does it give you anxiety to be around those people? Like a lot of social events? Yeah. Okay. I'm sorry. And just a little bit more in-depth questions. You don't have to answer them if you're uncomfortable with them. Anything that you say stays with me, unless the only things that I'm obligated to report is if you would harm yourself or someone else. So if you're comfortable, I just want to ask you about your sexual history or if you use any drugs. Is that okay with you? Okay. Are you sexually active? Not for 5 years? Okay. And do you take any drugs, like, or any illicit anything? Like, have you ever tried cocaine or marijuana or anything else? No. Okay. Any tobacco? No. How often do you think you drink? When you have to? Yeah, just at a party. Okay. Okay. Alrighty. And anything else that I might be missing? It sounds like you especially might get a little anxious whenever you're around a lot of people and you're drinking, whenever that happens, and you're losing sleep. Thank you. Thank you. Is there anything else that I might be missing? You're having a hard time sleeping because you're having a lot of thoughts going on in your head. You For the presentation? Sorry? Oh, there are certain medications that we can definitely try. It just depends on, there's something called propranolol. I did notice that your heart rate was actually pretty high today. It was actually 110, so that's pretty high, especially for just, seeing your doctor. So that might be something that can help you. It could be something that we explore. Is it okay if I listen to your heart really quickly? No physical exam. Okay, all right, that's totally fine. Is it okay if I listen to your heart though? Are you comfortable with that? Just because yes, please. Just because it was a little bit high. Okay, so I'm just gonna go ahead and drape you, and then I'm going to put my stethoscope on the 4 places on your chest and ask you to lift your breath so that I can listen to the mitral valve area as well. Any findings? No. Okay. Okay. Alrighty. So that was the main thing that I wanted to look at in terms of physical exams. So I'm going to go ahead and close out with you today. So it seems like the main thing that you're struggling with is feeling very tired and not being having a lot on your mind, being anxious, especially at presentations. Is there anything else that you have been feeling that you might want to tell me? Yeah, yeah, um, yeah. Yeah, that's definitely understandable. Is it because you feel like it's difficult whenever you go out and talk to people? Yeah. Do you want to explore options like therapy and potentially any kind of any drugs for social anxiety? Would you be interested in something like that? Yeah. Yeah, absolutely. I mean, it seems like this is something that you've been struggling with for almost 20 years now. So it could be something that would really benefit you. The treatment could be, just talking to a therapist, or it could also mean some medications involved as well. But I'm happy that you came in today and you're telling me everything that you did. That's definitely the step in the right direction. Um, and just to close this out really quick, have you had any suicidal thoughts or thoughts of hurting yourself or other people? Okay. Okay. No plans or anything to hurt yourself? No self harm? Okay. Okay. That's great. I'm happy to hear that. And again, I'm sorry though over the last 3 months it has been, even more so than usual. Is there anything else I can do to help you today? Yeah, that's my job. And I'm really happy that you were able to tell me everything. So the plan would be basically maybe we could get you started with whatever you're comfortable with, maybe seeing a therapist if you're okay with that. We can absolutely refer you to people that will help you with these feelings and, you know, these anxieties that you've been having for a long time. And if that isn't that's usually the first thing that we do. And if that doesn't help on its own, then we give you some medication as well. And there are some minor drugs as well that can help with, like, you take before your presentations and all of that. So yeah, there's a lot of steps that we can take for you to feel better. Okay. Yes. And I want you to feel better as well. So let's work on that. So now we know the plan and everything. Any questions for me? Oh yeah, no, absolutely. There's no reason. Okay. Knock, knock. Oh. Knock, knock. Hello, my name's Kaylee. I'm the doctor that's seeing you today, Dr. Watson. Is it okay if I call you Bennett, Mr. Bennett? Perfect. Okay. So you're here on behalf of your grandson? Ryan. Oh, I'm sorry to hear that. I know it's hard to see a kiddo coughing up. How long has this been going on? 2 months. Okay, that's a long time. Does he have any history of something like this in the past? Mhm. Okay. What were those like? The bronchitis? Mhm. Mhm. Yeah. Did he need any inhalers? Yeah. Okay. Did he take any antibiotics, or was it severe enough that he needed any kind of extra measures? Okay, that's good. I'm happy you're involved. And what do you think makes this different? Because you said that this is different from his usual bouts of bronchitis. Mm-hmm. 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 Yeah. Is it? Mm-hmm. 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 Yeah, but his chest was hurting. Mm-hmm. Yeah. Yeah. Okay. Sorry if I'm looking down. I'm just trying to make sure that I, break down the important stuff. So you're saying 4 months ago he started feeling tired and just not himself. 3 months ago he had a funny feeling in his chest, and 2 months ago is when he started having this cough that just won't go away, but nothing's coming up. Mm-hmm. 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 Does he ever cough so much that he throws up? Okay. And the cough, is it worse at any time in the day? Like in the morning, it's worse. At night, it's worse. It's worse at night. Okay. Um, has he tried anything that helps, like any kind of saline or any inhaler, anything? Mm-hmm. 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 Yeah. Okay. Yeah. Yeah. That's good to hear. Does is there anyone in the family that has something like this, like asthma or COPD, any kind of lung diseases? No. Does he have any history, like when he was a baby, that he had asthma or skin lesions, like eczema? Does he get allergies? Okay. And is there any family history that I should be aware of? Mm-hmm. 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 That's hard to hear. I know that. Yeah. Yeah. I mean, secondhand smoke is a real. Has she ever tried to quit before? Mm-hmm. Mm-hmm. Yeah. Well, I mean, if she ever, I mean, she's not here today, but if she were, then we would offer her any kind of help that she needs because secondhand smoke can really affect a child's ears, their lungs, so many things, especially since he's so young. So if she ever wants to have any, any kind of help with that, then we're happy to do that, especially in the interest of Ryan. Um, so if she ever wants to, uh, but anything else? Does she have any cough or anything like that? No. Okay. Any heart conditions in the family? No. Okay. Alrighty. Is there anything else that I might be missing with Ryan? Okay. And you said that he's getting tired. Do you ever notice like any night sweats, any easy bruising? No. Okay. It's mostly just the getting tired. Is it whenever he's running around? Is it ever at rest? Uh-huh. Mm-hmm. 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 Okay. And there's no history of any heart conditions, right? Like he got checked out before the nurse said that there wasn't anything. Okay. All right. But whenever, so he's running around, he gets winded, he sits down, and it gets better. Okay. Okay. And the cough is waking him up at night. That's hard to hear. Okay. Did you have you noticed anything with him physically? Like any does he have any like, lymph nodes? You know how kids kind of get them, or you can get them too whenever you have like swollen lymph nodes when you're sick. Does he ever have that? I don't have him here, so yeah. Okay. Alrighty. And then I would do a physical exam normally at this point. But since he's not here, you're not noticing anything on him, right? You said no wheezing normally, no changes besides like he is just more tired and everything, right? But no like obvious things. Okay, got it. Is there anything that I might be missing out on? Okay, thank you. And then in terms of the plan, it to me it sounds like he might have some sort of asthma, just because of the mom. She's smoking, and it does get worse with that, or it could just be secondhand smoke in general. And what we do about that is maybe we could just check his lung functioning, see if everything's okay. It doesn't sound like a bacteria or a virus, just because it's been going on for so long and he isn't producing any phlegm, like you said. So I don't think that we need to do that. He might benefit from some inhalers that would be done after we do some testing. Is there any questions that you have pertaining to that so far? Mm-hmm. Mm-hmm. Yeah, I mean that's obviously a fear to have, but you know he has lovely people like you that care about him, and he's coming in early. He's 6 years old. A lot of people get over asthma in their later adult life. Sometimes it's just an inhaler for a week. Sometimes it takes a little bit longer. There's medications that if it does progress, there's ways to slow it down, make it better. Obviously, decreasing his exposure to smoke would be very helpful. But it does sound like that mostly because of the cough that's worse at night as well. Usually, that's very specific to asthma. If he's waking up from it, that's what has me to believe that. Um, I'm not really worried about other things, like I said, like a pneumonia or anything scary like that. It doesn't sound like because when you see your grandson slowing down, you might think big worries like, oh my gosh, does he have cancer or anything like that? But from what you said, it sounds like mostly something involving his lungs because of the cough and everything. You haven't noticed any skin changes. You haven't noticed any swellings, and so I'm not too worried about that at the moment. So we're going to investigate these other things just to, help you kind of put those anxieties at rest. Any other questions with that? Okay, perfect. Alrighty. So yeah, so the plan would mostly be, making sure that we understand if he does have asthma. That's usually just, a quick test where he blows into something. We check to see how his lungs are doing, and then based on that, we might give him an inhaler, see if it improves. If it improves, then that might just be the treatment, and he might get better, and he might never need the inhaler ever again. Or there's other treatments, and again, like I said, if your daughter or I'm not sure if she's your daughter, sorry, but the mother, if she ever wants to explore that, there are a lot of resources for quitting tobacco as well. Yeah, anything else that I might be missing? Okay, perfect. Much appreciated. And thank you. Alrighty, I'm gonna get started on the note. Thank you for, being a good grandpa and caring about your grandson. Bye. Thank you. Knock, knock. Knock, knock. Hello. Hi, my name's Dr. Watson. I'll be conducting your interview today. Is it okay if I call you Miss Bank? Okay, perfect. Alrighty. So what brings you in today, Ms. Bank? Your stomach hurts really bad? Okay. How long has that been going on? Oh, 6 hours. Okay. Can you tell me more about it? Mm-hmm. Mm-hmm. Okay. Is it like a sharp pain, a dull pain? Sharp and stabbing? Okay. And was it dull before? Okay. If I'm looking down, I'm just writing to make sure that I have everything that's important. Okay. So 6 hours, and then it was, sharp, but it's been getting worse, and now it's on the right lower side. Have you taken anything to try to help? Mm-hmm. 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 Okay. Have you had any nausea or vomiting? Okay. Okay. And what was it? Not to be too graphic, but was it green? Was it? Do you remember what color it was? Mm-hmm. Okay. So no blood or anything, right? Okay, that's good. Alrighty. Any loss of appetite? Yeah. Yeah, I would imagine. I'm sorry about that. How would you rate this pain? Feels like a 10? Okay. I'm sorry to hear that. We'll definitely try our best to make you feel comfortable. Um, have you had anything like this before? Okay. Okay. Anything that I might be missing? You have it's been 6 hours, it's gotten worse, medication hasn't helped, you've thrown up. Anything else? Yeah, yeah. No, it looks like today you had 103 temperature. That's definitely a temperature. Yeah, for sure. Es- Yeah, especially after you've taken some Advil. So that's definitely something we're keeping an eye on. Anything else? Okay. Is it okay if I ask you some of your past medical history? Okay. Do you have any medical conditions? No, no diabetes, hypertension, and you're only 21. So, okay. Any allergies? Are you taking any medications? No. Okay. Are you on oral contraceptives or anything like that? No. Okay. Do you have a family history that I should know of? Like, does your mom have diabetes or anything like that? No. Okay. And do you have? Sorry. When was your last menstrual period? 10 days ago. Okay. And are you sexually active? Yes. Okay. And just to let you know, everything that stays in this room is between you and I. The only things I'm obligated to report is if you're going to hurt yourself or someone else. So I might ask you a couple of questions that seem a bit more personal, but I promise it stays within this room. Um, so you're sexually active. What kind of partners do you have? Are they male, female, male? How many have you had in the last year? Partners that are male? Just one? Alrighty. Do you use condoms? Alrighty. Consistently? Great. Have you visited your OB-GYN before? I know these seem like random questions, but the ovaries are around there, so they can be involved. Have you gone to the OB-GYN before? Mhm. Okay. did they tell you anything? Like you have some kind of, like there's certain things like endometriosis, cysts. Did they tell you anything about that? Everything was normal? Okay, that's good to hear. Alrighty. And your last menstrual period was 10 days ago. Do you have normal menstrual periods usually? Yes. Okay, perfect. Alrighty. Sorry, I realize that you're in pain. Are you taking anything like any marijuana or any other illicit drugs? No? Okay. And do you live at home? Are you married? You live alone? Alrighty. Alrighty. So I'll go ahead and do your physical exam since I know you're in pain and I, want to get this done as soon as possible. So I'm just going to lay you down and drape you, and I will do an abdominal exam since that's where most of your pain is. I'll start in the left lower quadrant since that's the furthest away from your pain, and just lightly palpate in all four quadrants. Do I have any findings with that? Okay. And then I'll do it a bit. I'll push in and then pull off really quickly in the right lower quadrant. Any findings with that? Okay, when I release. Okay. And then I will go ahead and lift up your leg and bend it to see the psoas sign. Negative. Okay. And then the obturator sign. Negative. Okay. Okay. Good to know. And then I will go ahead and have you sit up and I'll put the drape back over. Did I see any scars or hear anything as well? Sorry, I forgot to say look for scars or that sounds normal. Okay, got it. And do you have any surgical history? No. Okay. Alrighty. And so now that I kind of have an idea of what's going on, the most likely thing that I can think of would be appendicitis. And for that, we could do some imaging. The imaging would be like a CT scan just to see if there's inflammation going on. And we could give you some antibiotics. It doesn't necessarily mean that you have to have a surgery or anything, but you are having severe symptoms. So it may escalate to that where we may have to take out the appendix. Do you have any questions for me? Yeah. Yeah, anything has its risks, obviously, but this is a surgery that's performed very often, and there's a lot of different medications, or sorry, there's a lot of advances with appendicitis because a lot of people end up having it. In the past, it was that you diagnosed it just from what I see, but now we're taking more steps to do the imaging, try antibiotics first, so we may not even have to escalate to that point, but you are having severe symptoms. You have your fever, you have really bad pain. Whenever I release, that could mean that you have inflammation all over your stomach, all over your abdomen. And we don't want that to escalate, because those are some major complications. It's more of a risk to not escalate care than to let this take its course, if you know what I mean. Mm-hmm. Yeah. And mhm. Yeah, absolutely. I will go ahead and discuss with the doctors that are on the case as well. Since you already did take the Advil and Tylenol, but we definitely want to make sure that we're managing your pain, especially if it's a 10 out of 10. That's difficult. But we're definitely going to give you some antibiotics and some pain management as well. Any other questions? Alrighty. So it does really seem like it would be the appendicitis. Other things would be something with your ovaries, but it doesn't sound like that based on what you've told me. So it seems like you have a pretty clear cut picture, and it should be something that completely goes away. 5 more minutes. It should be something that goes away after surgery or hopefully after antibiotics. So this isn't something that you'll have to deal with for the rest of your life, at least. You know, it's very treatable and manageable. Yeah, of course. I'm sorry. I know this is really scary. You know, all of a sudden you have a lot of pain and you're even throwing up. I'm sure that, you know, you're 21, you're really young, and to have something like this, I definitely want to make sure that you're comfortable and we'll get the ball rolling, okay? All right. Of course. Any other questions for me? Am I missing anything? Okay, perfect. All righty. So I'm going to go ahead and get started on my note. What? I'll grab it. Knock, knock. Alrighty. Hello, my name is Dr. Watson. I will be conducting your interview today. And is it okay if I call you Miss Lipton? Mrs. Lipton? Okay, perfect. I'll go ahead and call you that. Okay, Mrs. Lipton, what brings you in today? Mm-hmm. Okay. So it's been since 4 months. What would you say is not feeling right to you? Hmm. Okay. Alrighty. I'm going to be looking down and writing a few notes just to make sure I have everything. Just wanted to let you know. So for the past 4 months, ever since you had your party that you hosted, you've been having the pain in your neck and you're tired all the time. It was your neck and your hips? Okay. Okay. Understood. Alrighty. Have you had anything like this in the past? Okay. And was there anything that happened at this event that you think might have caused it? Overexertion? Did you lift anything? Did you fall? Hmm. Mm-hmm. Yeah, that's pretty unusual. And when you say tired, do you get enough sleep at night? Do Okay, so you're sleeping fine, but you still feel tired throughout the day. Yeah, okay. And that's been about the same amount of time that you've had this pain as well? Okay. And do you mind describing the quality of pain that you're experiencing in your shoulder, neck, and your hips? Is it like a dull pain? Achy pain. Okay. Achy pain. Is there any other things that you're experiencing besides the pain and tiredness? No? Okay. You're not having any, your hair's not falling out, you're not having any constipation, diarrhea. Do you feel weak when you're moving? Okay. It's more of a pain. It's not necessarily like a stiffness when you move or anything like that. Stiffness in the morning. Okay. Does anything help it? Both. Yeah. Uh-huh. Mhm. Okay. So just so some relief, but not total relief. Okay. Okay. And besides that, no like tingling sensations or anything like do you ever get yeah, like a tingling sensation, pins and needles in your hands or feet? Okay. Okay. So I think I have a good understanding of the main reason that you're here today. Is it okay if I start going into your past medical history? Okay. Do you have any medical conditions that I should be aware of? Okay. Are you on medications for that? Do you know what dosages you're on? Not offhand. That's totally fine. For the lowest, how long have you been taking both of these medications? Hmm. Okay. Okay. 9 months. Understood. Um, and in terms of family history, are your parents still alive? Did they have any medical conditions I should be aware of? Okay. No autoimmune disorders in the family, like lupus or rheumatoid arthritis? Okay. Do you have any children? That's lovely. Alrighty. Are they healthy? Perfect. Alrighty. And are you currently menstruating? Or did you go through menopause? Okay. Do you remember when that was by any chance? 52. Alrighty. Understood. And do you see your gyno regularly? Mm-hmm. Perfect. Alrighty. And everything that you say stays in here in this room. Besides, the only things that I'm obligated to report is if you want to hurt yourself or others. So if I ask any personal questions, feel free to not answer. But I just want to let you know everything that you say is safe in here. Um, I just wanted to ask you about some more personal questions. Do you use any illicit drugs like cocaine, marijuana? Nothing? No? Okay. Are you currently sexually active? Oh, I'm sorry to hear that. 3 years ago? I'm sorry. How have you been coping with that? Hmm. Yeah. Yeah. That's good. Sounds like you're on the other side of it. It's good that you had a partner in life and got some children out of it. Oh my gosh. That's amazing. 38 years. Wow. Yeah, I can't imagine. I mean, you're 64. You know, we're living to be 100 and something. So that's definitely a life cut short. I'm sorry to hear about that, but I'm happy that you have a good support system and everything, and you seem to be handling things well. How's your mental state otherwise? Yeah, yeah, yeah. No, I can understand that. You're not, but you don't feel like depressed, down overall. Get it solved? Yeah, perfect. Alrighty. And then, so it seems like I have a good understanding. Is there any questions that you have for me for now? Yeah, yeah, absolutely. Okay. And I'll first I would just like to do a quick physical exam before I get into that, of course. Um, Sorry, just to summarize really quick to make sure I'm not missing anything. As of right now, it seems like you, and it also looks like you have a little bit of a fever too. We saw that you have I saw that you have 100.4 fever. Do you ever feel warm? No. Okay. Okay. Well, that's something that we'll definitely investigate. It could be something that points us in a certain direction as well. Um, so, from what I understand, for the last 4 months, you've been feeling these achy pains in your neck, in your shoulders, in your hips, and you've also been feeling very tired. It does get better when you move around a little bit, when you take hot showers, but it's worse when you sit down for a while. You're not experiencing any weakness or tingling or anything, though. Ibuprofen helps a little bit, but the pain never completely goes away. Is there anything that I'm missing? uh, Thank you. Okay, so I'm going to go ahead and do a quick physical exam. I'm going to have you sit and I'm going to drape you and I'm going to go ahead and try to palpate down your neck and spine to see if there's any tenderness whenever I touch. Okay, so if you have the gown on, I would expose your back so that I could see it, but still have you draped. Yeah, I would expose your back so I could see your spine, and then I would palpate all along the spine from the neck down to see if you have any point tenderness in any specific places. Okay, and then I would go ahead and close it back up. And then I would ask you to move your arm, like hold your arms out like this, and just, or sorry, I would move it passively first. So I would have you just sit comfortably, and then I would move your arms passively and see if there's any pain with that over the head, like this. Okay. Is that with active movement or active and passive? Okay. And then I would like to have you stand up if you're comfortable with it and have you bend over completely to almost touch your toes just to see your range of motion of the spine. Okay. And then I would have you sit back down and I would have you lay down and try to palpate along the trochanteric, yeah, like the hip bone area to see if there's any point tenderness there. I would palpate in the hip area over the gown, just to yeah to see while you're laying down and draped. Okay, understood. Alrighty, and then I would have you sit back up and have you draped again, and so I would be done with my physical exam at that point. Um, yes, I would be done at that point, and then I would like to have my closure. So, from what I gather, it seems like you have been having this pain for quite some time and it hasn't been alleviated with the things that you have tried so far, and you also have been feeling very tired. I would like to investigate more. There are certain things that point me in certain directions, like your fever, your tiredness. That could be certain autoimmune diseases, such as there's different ones like polymyalgia rheumatica. It's a long name, but there's investigations that we can do, and if that is the case, certain things that we discover may lead us to certain treatments like steroids or other alleviating things. So this might not be something that you have to deal with forever. If we don't find anything there, we might have some imaging that we can do, like x-rays, to see if it's your bone. But from what I gather from the physical exam as well, it seems more muscular. So I don't think that, yeah, 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 more muscular, right? And you don't have any incredibly worrying signs that would make me think that this is something truly scary. Like, you don't have any headaches or anything, right? Like any throbbing headaches, yeah, or loss of vision or anything like that. Yeah, so those are things that we would look for to be a bit more scared. And even those things, there's still things that are treatable. But from what I've gathered, it seems like this is something that we can pursue. We can investigate more with blood tests, possibly imaging, and then there are treatments. So this is not something you have to deal with forever. It could also even be, you started taking your statin 9 months ago, and you started having these symptoms about 4 months ago. And some people do have the side effect of muscle pain with statins. So that could be something that we alter as well. Well, we would like to decrease the statin. A lot of times that's what we do. We go from, depending on your dosage, we go from high to low. Yeah, 10-minute patient note. Thank you. Thank you very much. Thank you. Alrighty. Knock, knock. Hello. My name is Dr. Watson. I'll be conducting your interview today. Is it okay if I call you Miss Santos? Mrs. Santos? Alrighty, Mrs. Santos. What brings you in today? Okay. When you say follow up, were you diagnosed with this were you diagnosed with hypertension, or is just like a one-time finding? 10 years ago? Okay. Are you taking anything for it? Okay. Do you know what dosage? Okay, no problem. And how have you been taking your blood pressure at home? Not in quite a while. Okay. Alrighty. Have you been taking your medications properly? You know, like every day, not missing out on anything? That's good. Alrighty. Good to know. All right, I'm gonna be looking down just to write a couple things, just to let you know. Alrighty. So today it looks like your blood pressure was a little bit high, 160/94. We like it lower than 140. So do you have any idea of what your blood pressure has been in the past? Yeah. Alrighty. And do you have any other any other medical conditions besides the high blood pressure? No, you're nice and healthy. That's good. Alrighty. So you're just on the one medication, but your blood pressure is still a little bit high. Okay. Do you take any other medication besides the hydrochlorothiazide? Any vitamins? No. Okay. Is there anything else do you have any other questions about your hypertension or any comments on it? Concern. Mm-hmm, mm-hmm. have you noticed any headaches or any changes in vision? Mhm. Okay. Off and on? Is it like the room looks a little bit blurry? Is there any like times of the day that it happens or it's kind of random? Okay. And that's been happening for a year? Okay. Blurriness in vision. Okay. And have you seen I see that you wear glasses. Have you seen an ophthalmologist or optometrist? Okay. Okay. Is there a reason for that? Just you've been feeling healthy, so you didn't want to go? Yeah. Yeah. What's keeping you busy? Any stress or yeah. Yeah. That's good. Uh-huh. Yeah. Yeah. Where do you work? Ooh, wow. Okay. Yeah, that is that getting like any more stressful or is it about the same? Mhm. Mhm. Okay. Sorry, I don't mean to seem like I'm prying, it's something that I'd like to investigate just because, your blood pressure is a bit higher and we just want to see if there's any reason for it. Sometimes stress can cause your blood pressure to go a little bit higher. Um, and especially, if you take it at home, then you might find that some people, their blood pressure is high in the office, but when they take it at home, they're nice and relaxed. So it could have just been this one reading, but it is a little bit concerning that you're having the blurry vision. So that could be related to the hypertension. Or have you had any other investigations? Like, have you ever had your HbA1c measured, like screened for diabetes? Mhm. Okay. Yeah, just wanna make sure, because I know that once you have hypertension, then they tend to check for those things, they check your heart, they'll check for diabetes, they'll check for your lipids, like your fats and everything. So if they did all that and you were clear, then it's probably not any of those, but we can always repeat that today as well. But it seems like some changes happened, the increased stress, or it could just be just that you might need a medication modification. Um, but yeah, sorry, I know I'm saying a lot. Is it too much are you understanding everything? Yeah. 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 Sorry about that. I don't mean to throw everything out there. But the blurriness of vision's a bit concerning and the higher blood pressure. That's why, I'm trying to get as much information as I can. Um, so any other new events over the last year besides the blurriness of vision, the increased stress? Just because you haven't seen one. Mhm. Mm. Mm. Okay. Is it only like how far do you think you can walk before you start feeling these symptoms? Mm. Okay. Okay. Has that how long has that been going on? Okay. Okay. Have you ever had a EKG or anything where they look at your heart before? No. Okay, so that might be something that we want to do today as well, because that does sound like a heart related issue. Have you ever had any have you ever had any like pain in your stomach or your jaw or your arm? No? Okay. Do you sleep with any extra pillows? No? Any swelling anywhere? Mm-hmm. Mm-hmm. Does it go away if you lift your legs? Mm-hmm. Yeah. Okay. And that's been going on for the last year or two, right? Okay. Okay. Have you noticed any changes in urination? I know that seems like a random question. Mm-hmm. Mm-hmm. Are you having any pain with urination? Mm-hmm. Have you ever noticed any change in color? Like, does it ever seem bloody to you or more brown? Okay. It's just a little bit of decreased. Are you drinking the same amount of fluids? Are you eating the same? Yeah, yeah. Okay. Alrighty. So, am I missing anything besides, you're having the blurriness in your vision, you're having a bit of swelling of your ankles at the end of the day, and you've been peeing a little bit less, and when you exercise, you get a little short of breath. Anything else? Okay. Okay. Um, do you get really cold? No. No? Okay. So your toenails get a little bluish, but have you had any skin changes? Like, have you noticed any ulcers or no? Okay. And does it change with the temperature? Like, does that happen more when you're in the cold or anything? Okay. Hmm. Do you have any? I don't. You might be familiar with it, but do you have any varicose veins? Okay. Alrighty. Have you had any cough? Okay. Okay, so I'd like to go ahead and jump into the physical exam. So I'd have you sit up on the table and I would have you bring the gown down so I could listen to your heart. And I would listen to all four valve areas. I'd ask you to lift your breath so I could listen to the mitral valve. And if I would hear anything, what am I finding? Normal? Okay. And then I'd put the gown back up. I'd ask you to lay down at a 45-degree angle and I'd tilt your head. And look for any JVD, normal JVD. Okay. And then I would still have you lay down with the drape over you. And I would try to check your peripheral pulses, like in your ankles and in your wrists as well. Normal pulses. Okay. Okay. And then I would ask you to sit back up and drape you, and I would be done with the physical exam. Or I would be able to, if I have time, do the blood pressure, repeat blood pressure because it was elevated, so maybe it's down a bit more now. So I might do a manual blood pressure. Is there any findings with that? Okay. And then I would go ahead and move on to my closure. So today we found that over the last year, you have been having more symptoms. You have been having the increased tiredness whenever you work out. That's not normal for you. You're swelling up. You notice some bluish toes. You're peeing a little bit less, and the blurriness of vision. All of those can be concerning for some issues with your heart, which can be related to uncontrolled hypertension. I would like to go ahead and investigate those things if that's okay with you, because we'd like to get ahead of it. That would be with imaging and some blood and urine tests. We could basically recheck all the things that you had before, and some of those vision changes could also be related to diabetes as well. All of these things are very treatable. Nothing to be incredibly concerned about. It's just something that we have to get ahead of. And it's great that you're coming in now. I know that you're very busy. I know that this is something that, isn't fun to deal with, but if we get ahead of it, you're a lot less likely to deal with major heart issues because you are showing some warning signs with the vision and the swelling and all of that. All of that kind of points to a heart issue. So that's where I would like to move forward, and hopefully you're comfortable with that. Do you have any questions? That's what we're avoiding. That's what we're trying to get ahead of, because that can happen if you have the high blood pressure, if it doesn't seem like you're on any statins or aspirins, and someone your age with hypertension might want to be on that. So that can eventually lead to a MI, a heart attack. But that's not the main concern here today. I think that the main concern is getting ahead of the symptoms that you're experiencing right now. I don't think that the anxiety of a potential heart attack should be on your mind. Yeah. If anything, we want to decrease the anxiety. We want to calm down a bit because that can help relieve some hypertension. So for now, like I said, we might want to modify your hypertension medication. So the hydrochlorothiazide might want to increase or add depending on how that works for you. And also, we'd like to investigate more with some imaging and some blood and urine, if that's okay. All right. Any other questions? Okay. Alrighty. Well, it was lovely seeing you today, and congrats on your amazing job. I'm gonna go ahead and start the note. Thank you. Knock, knock. Good morning. Hello. My name is Dr. Watson. I'll be doing your interview today. Is it okay if I call you Mrs. Kerrigan? Miss Kerrigan? Mary is fine? Alrighty, Mary. What brings you in today? For how long? 3 months? Okay. Can you tell me more about it? Okay. I'm going to be looking down a little bit, just writing a couple of things just to let you know. So 3 months of diarrhea, but then on the weekends you're constipated. Okay. Was there anything that happened 3 months ago, like any travel, any new medications? A promotion? That's good. Is that stressful for you? Yeah. Yeah. Okay. Well, do you mind describing the diarrhea to me? Is it watery? Is there any blood? And then on the weekends, it's just regular or? Okay. Is there any abdominal pain with this? Okay. Stomach cramps. Does it go away once you actually have the diarrhea or? Okay. And how many bowel movements do you think you're having on per day when you have the diarrhea? 3 to 4. Okay. Alrighty. Is there anything that I might be missing besides the diarrhea and then the weekend's constipation? It's watery in quality. It's 3 to 4 times. Anything else you can think of? Does anything make it? In terms of fixing it, I mean, I have a few more things to ask and do a physical exam as well. I'm sorry, I know that you're busy. I'll be sure to be as quick as possible. But besides that, are you having any, like, are you feeling fatigued? Anything else? No? Okay. Alrighty. Is it okay if I go ahead and get into your past medical history then? Yeah. Do you have any other diagnoses or medical issues that you know of? No? Okay. Are you taking any medications? Imodium? Okay. How long have you been taking that? Mhm. Okay. Do you know the doses for that? Does it help at all? Yeah, that's good. Okay. And did you start taking it with the stomach cramps, like as soon as you started, or were they kind of at the same time? Okay. Okay. And it does help, so that's good. Um, and any other medications besides that? Okay. In terms of family history, do you have any family history like this? Mhm. 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 Okay. Does she have anything else besides the episodes of diarrhea or constipation? No. Does your father have anything? Okay. Do you have any siblings or children? No. Any cancers in the family? No. Okay, that's good. And then in terms of OB-GYN, do you see your OB gynecologist? Yeah. Do you know when your last menstrual period was? A week ago? Okay. And you're usually pretty regular? Okay. Alrighty. No, are you currently sexually active? No. Do you have a partner or no? Okay. Within the last year, have you had any partners? No. Alrighty. And then in terms of social, all of these things that you tell me are confidential. The only thing I would ever have to report is if you would like to hurt yourself or others. So I'm just going to ask you, a little bit more personal questions. Do you have any tobacco use or illicit drug use? No cocaine, opiates, nothing? Okay. Alrighty. And are you in the past were your partners male or female? Okay, no problem. And then uh, besides that, besides the promotion, any other stressors that you have going on in your life? Yeah. Do you have support in your family or any like friends, loved ones? That's good. That's good. Uh, do you feel overall pretty normal? Like no anxiety, changes in sleep? Mhm. 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 No, I mean it's just to get a full picture. If you're not losing sleep, do you ever feel like your heart's racing, sweating? No. Okay. You don't get any tremors or anything. Any headaches? No. Any nausea or vomiting? No. Alrighty. And then I believe I asked you, but were you traveling recently at all? Yeah. Okay. Alrighty. So am I missing anything over the last 3 months? It's just been mostly the diarrhea on the weekdays and constipation on the weekends. Alrighty. But you haven't really felt fatigued or anything, right? Okay, perfect. And no blood, nothing too scary. Okay. Is it okay if I go ahead and get into the physical exam? Alrighty. So I would have you lay down and I would drape you but expose your stomach. And I would inspect your stomach for any scars or anything you might have had. Okay. And then I would listen to your bowel sounds in all four quadrants. Okay. And then I would lightly palpate in all four quadrants as well. I would go from the right upper quadrant in a clockwise order. The right. Uh-huh. Okay, understood. Okay, and then after that, I would go ahead and put the gown back on your stomach, and then I would ask you to sit up, and I would be done with the abdominal exam. And then in terms of closure, I would just like to talk to you about the what we found today. So, in terms of your diarrhea and constipation, there is something that is called irritable bowel syndrome, and that's what your symptoms are really telling me in the physical examination, and that's usually brought on by stress. And that might not be something that you want to hear, and I totally understand that. But it is something that, once you relieve some stress, it actually is something that is somewhat that might go away completely, or it's sometimes it can just be your body telling you, hey, maybe you need to slow down a little bit, because that tends to be the main that we find, especially you're working very hard and you notice that within the past 3 months, right when you got your promotion, that's when this happened, right? So I'm sure that you can make the connection too. It is something like you're already taking the Imodium. That doesn't necessarily help it too much, but I'm happy that you're having some relief with it. The main thing would be the like a little bit of decrease of stress as much as you can. But in terms of concern, IBS or irritable bowel syndrome is something that's very benign. It's not something that we worry about like some kind of cancer or parasite or bacteria or virus. It's something that you probably won't have to live with forever. It's just lifestyle management, decreasing your stress as much as possible. Is there any questions that you have for me? No, I was saying that this is probably something that you won't have to deal with forever. Yeah, sorry. Well, no, you're kind of already taking the pills that would potentially help, but from what we see, there's not really something that makes it go away completely. It's more of the stress management. That's the main aggravating thing that we see usually. And once you decrease stress, there tends to be like almost an exact correlation. Like the less stress, the less symptoms that you'll have. So the weekends will become more regular, the weekdays will become more regular. It's just checking in with yourself. Do you have any interest in maybe seeing, I know that you are very busy, I know that a promotion is a lot, but do you have any interest in seeking a psychologist to kind of help you bring down the stress level? Hmm. Yeah, so we can definitely, yeah, that can definitely be the next steps. We can definitely refer you to a psychologist that can definitely help with that. I'm always here if you would like to see me, if your symptoms are improving, or if you notice any major changes that you're concerned about, like if you start having blood or mucus or anything, then you might want to come back in and, we'll discuss it then and maybe do some more testing. But as of right now, everything seems pretty benign, and it seems like the major thing would be, decreasing stress and possibly moving forward with the psychologist and everything, and we'll get you started with that. Perfect. Alrighty. And good luck with the promotion, and good luck with, getting nice and healthy. Okay, thank you. I'm going to start my note. Thank you. Alrighty, guys, that was it. I did my whole exam. I'm feeling pretty okay, I guess, especially for not really doing anything. It felt pretty similar to a lot of the practice stuff that we did at roles before. So, yeah. Some of them I was definitely more anxious than others, and yeah. But yeah, hopefully you guys liked a little bit of interviewing that you saw.